So thank you very much for this opportunity. I should tell our viewers, my name is Noleb Mojisha. I am a medical doctor. I work here at the Uganda Cancer Institute, and I lead the team that provides cancer awareness and cancer screening services. We call our program Comprehensive Community Cancer Program, responsible for increasing cancer awareness and providing cancer early detection services. I usually like telling people that it's important to know what every disease is, because that helps you when you explain to people. So breast cancer is a disease that results when breast cells become abnormal and begin to multiply out of control, leading to an excess number of those abnormal cells, which usually in the breast form a swelling, which we call a lump, or a tumor in medicine, that is a breast cancer tumor. So again, I want to say the cells become abnormal, they become cancer cells. When they become cancer cells, they multiply out of control. And for our viewers to understand us clearly is that cells multiply, but the body has a control over that multiplication process. So cells multiply and new ones replace old ones, and you know, the body moves on. But when a cell becomes a cancer cell, the body's ability to regulate that multiplication ceases to have control over this abnormal cell. So the cell, in other words, becomes a rebel. It begins to multiply out of control, leading to an excess number of these abnormal cells, which are cancer cells. So when we're talking about cancer, usually I like telling people that you should understand that the abnormality is the cell. And even when we are examining a patient, we want to confirm cancer, we have to take a biopsy, examine those cells, and confirm that actually the cells are cancer cells. And happen in the lung, then the person will suffer from lung cancer. It happens in the prostate, the person suffers from prostate cancer. It can happen anywhere, and the cancer will be named, after that cell that primarily became abnormal. So for breast cancer, it begins in the breast. The abnormal cell is the breast cell. Usually, what causes this change is sometimes difficult for us to pinpoint and say this is the one. That's why we say for many cancers, the causes are multifactorial, and we call them risk factors, not causes, because some of them on their own as individual factors cannot lead to the cancer. But there are a number of factors that come together to eventually make this cell become a cancer cell. So we don't say the cause is the cell, because the cell also was pushed by something to become a cancer cell. Yes, and so for breast cancer, the risk factors, one. Now I must say again that for any cancer to start, there must be a genetic abnormality, and this we call a mutation. And many of our viewers, understand the word mutation, because the mutation is what happens in the DNA, which is in every cell. And when the DNA, when there is a change in the DNA, because the change is like the commanding center of the cell that determines how the cell behaves. So when there is a change in this DNA, the behavior of the cell changes. And one of the changes that can happen is the change that can lead the cell to behave as a cancer cell. So these factors are, one, for breast cancer, one is family history. So there are some people who are born, and they are born with this genetic change. They are born with a gene that puts them at risk of their cells eventually becoming, of their breast cells eventually becoming breast cancer cells. So there is a genetic predisposition, but when we are, mentioning risk factors, we say family history of breast cancer. And we know that 5 to 10% of all breast cancers are due to family history, also an inherited gene. But the rest of, 95 to 90% of the breast cancers, the genetic change happens as the person lives their own lives. So family history. The second one is obesity or overweight. And the reason is, when a woman is overweight, the excess fat is converted into estrogen when they reach menopause, meaning that overweight women are likely to have higher estrogen levels even after menopause. Now, usually women, after they stop going into their periods, it means that their body has started reducing the quantity of estrogen hormones that are being produced. But if for any reason that quantity is prolonged thereafter, then the risk of the breast cells becoming cancerous goes higher. So overweight, because this is also kind of in line with hormonal replacement therapy for women who don't want to get into menopause, hormonal replacement therapy puts them at risk of suffering from cancer of the breast. So, family history. So if anyone has a family member who has suffered from breast cancer, it could mean they could have this gene. So they need to have routine checkups. Overweight, so we should all make sure we don't eat high fat diet. I talked about family history, overweight, and this then we say minimal physical activity or minimal exercise, which is in line with overweight, minimal. But also for breast cancer, we also know that tobacco use is a risk factor. Now, tobacco use is a risk factor for many cancers, but including breast cancer. For breast cancer, it's not a very strong risk factor. Then, alcohol consumption. Actually, research has shown that the risk for breast cancer is directly proportional to the quantity of alcohol consumed. The more the alcohol, the greater the risk. There is a good study that was done and demonstrated how much grams of alcohol a woman consumed and at what risk they were at suffering from cancer. There is also another study that was done recently and found out that people who have supper late, you eat a lot of food and you sleep, their risk of breast cancer goes high. And this is again in line with when you eat a lot of food and you sleep, much of that calories, much of that food is converted into fat. So you can see the bottom line is excess fat, and then this family history. So who is exactly at risk? Number one, everyone is at risk. And usually when I tell people this, then they are like, you mean also me? But like I said, for an individual to suffer from cancer, the cell, the breast cell, this particular cell that we are talking about, has to become a cancer cell. So as long as you have this cell in your body, you are at risk of suffering from the cancer. So women are at a higher risk than men, and we know that maybe women are 100 times more likely to suffer from breast cancer compared to men. But men are also at risk. But also, people who are at even a much higher risk are those who have suffered from breast cancer. You see, a woman can suffer from breast cancer in one breast, and the other breast remains normal. That woman is at risk of suffering from breast cancer in the other breast that remained. That's one. And then women and men who have a family history of breast cancer, especially first-degree relatives. Those with whom you know that you almost have the same genetic kind of makeup. Then it could mean you could have that gene. Yes. And then how common is it? I want to tell you that almost every day we get a breast cancer patient here at Uganda Cancer Institute. So in a year, we see over 200 patients with breast cancer, new patients. And then breast cancer is the second commonest cancer in women in Uganda after cancer of the cervix. But at least I must make this mention that it's about the second commonest, but it's also one of those ones that are very easy to treat and cure. So we have more survivors of breast cancer than all these other cancers. How can we avoid suffering from breast cancer? How can we reduce our risk? Now, I want to mention this, that when it comes to cancer, for many cancers, we do not have shots. Like you immunize a child against measles, and my child is safe. For cancer, usually that's not the scenario, that's not the case. But we can do things to reduce our risk. So for breast cancer, number one, do regular breast checkups. Regular breast checkups. Because breast cancer begins as a swelling in the breast many times. Either a discrete swelling in the breast, or the entire breast being swollen, or a swelling in the armpit, or some bloody discharge from the nipple. So do regular checkups. Now, regular checkups are not going to prevent a person from developing breast cancer, but they are going to help us discover the breast cancer early, treat it, and cure it. Yeah? And I began with it because that's the strongest tool that each and every one of us can equip themselves with. Number two, reduce the quantity of the high calorie diet you eat and the high fat diet you eat. And in this case, I want to mention dairy products, full cream milk, meat, especially fatty meat, a lot of cheese, even a lot of cooking oil. That's not healthy when it comes to breast cancer. It's also not healthy when it comes to prostate cancer. I must chip in this for men. Next month is a month for prostate cancer, so maybe you come again and we'll talk about prostate cancer. But reduce the quantity of fat diet that you eat, fatty foods that you eat. That's one. And then I usually, when I talk about high calorie diet, I'm talking about carbohydrate foods, posho, rice, sweet potatoes, yams, Irish. You understand? Our viewers, I guess you understand. That's the bulk of the food we eat. But usually when you're adults, we advise that you don't eat too much of this food. Eat more fruits and vegetables. So I usually tell people, the full amount that you eat of food should be like your fist. The rest of the food should be cabbage, nakati, those things that do not have calories. They will fill your stomach, take care of the hunger, yet they won't increase your danger, rather they will reduce your danger. So let's have a lot of fruits and vegetables, especially fresh fruits. Do physical activity. If your work involves sitting for a long time, like people who work in offices, doctors, colleagues who are out there, cultivate your lifestyle in such a way that you have time to do exercise. It's not that every single person who suffers from breast cancer, their breast has to be cut. I must emphasize that. When we catch this breast cancer very early, it could be possible to remove the tumor, the breast cancer tumor, and save the breast. But many times, it's very, very difficult. But I usually want to tell our viewers that don't come with a predetermined mind that my breast is going to be cut. No. Usually, there are different modalities of treating breast cancer, and we take the patient through, the process of why we're choosing this against the other. That's one. Number two, how do we help people deal with the stigma? One, there are artificial breasts that these women are given to wear, so that wherever they are passing, they don't see that they have one breast. Let alone to see they have no breast, because some people will have both of their breasts removed because of breast cancer. So that's one. Number two, we give them psychological support. We give them knowledge and information to know that even without a breast, you're still a full woman. You can make love with your husband. You can take care of your children. And I want to tell you, there are people who have lost one breast and they have had children with one breast. So usually giving them this information builds their confidence, and they are able to even move against the stigma. If anyone is stigmatizing them, then for them they don't feel stigmatized, because they know, I recovered and I'm normal. And then the other thing is that when we try to support them to use their testimonies to encourage other people to come forward for treatment, including removing breasts, because that also builds their esteem. They know they are now more useful to society than if they kept quiet and felt stigmatized, felt they are not full human beings. Treatment for breast cancer. One, breast cancer is in medicine we call it's a surgical cancer. The mainstay of treatment, or the main method of treating breast cancer, is by surgery. And this surgery can include removing the breast swelling or the the cancer tumor in the breast, or removing the entire breast, or removing a quarter of the breast or half of the breast, depending on what the healthcare provider and the patient choose to settle for, depending on what we want to achieve for this patient. So after surgery, breast cancer is treated with chemotherapy, cancer drugs. So we give them drugs for, standard is 6 cycles, which we give every 21 days. If I use like the commonest chemotherapy combinations that we use here at Cancer Institute, and that means we would give them treatment for 18 months, for 18 weeks, which is close to maybe 5-6 months. Okay. And then after that, depending on the stage of the cancer, then we can give radiotherapy. Radiotherapy is where we expose this part of the chest that had breast cancer to high energy radiation from a radiotherapy machine in order to destroy the cancer cells. And the purpose is to make sure that we've mopped out the cancer cells as much as we can, so we leave no cancer cell in this person's body. And then for some breast cancers also, we can give what we call hormonal therapy, where we give tablets. Usually this hormonal therapy is in form of tablets, the commonest that we use. The patient swallows them, and they block the estrogen and progesterone receptors in order to stop that hormone that I mentioned at the beginning, that sometimes mediates the progress of breast cancer. So when we're treating cancer, for breast cancer specifically, when the patient comes to us, maybe I didn't mention this, we usually take them through a battery of investigations, or what you could call tests, to ascertain how far the cancer had grown, the stage of the cancer. We call them staging investigations. And then also to ascertain how well this person's organs are working, the kidney, the heart, the liver. And then after that, we treat them. When we complete treatment, we do these tests, some of these tests again, to again confirm that, one, the cancer has been cleared from the body. Now at that point, we declare that the patient is in clinical remission, meaning that we cannot detect any cancer in their body. That may not mean that the cancer has been totally cleared. There may be some cancer cells somewhere that are quiet, and you cannot detect them. Then for breast cancer, many of them, if they benefit from hormonal therapy, we put them on hormonal therapy for 5 years. If within 5 years there is no evidence of cancer showing up, we declare them cured. But for every single cancer patient, they must continue to be followed up by their cancer treatment team for the rest of their lives. So a patient can be declared cured, but it doesn't mean that they cut contact with us, because we continue monitoring them so that in case any other cancer shows up, we can catch it early and treat it. In case the same cancer comes up, then we can also catch it early and treat it. We don't want to break our relationship with them and then they become like they have never been in contact with us.